Hi, I'm Dr. Kurt Wohler for Adrenal Mastery course. If you're like a lot of integrative health practitioners, whether you're an MD, a DO, a chiropractor, an acupuncturist, maybe a clinical nutritionist, or another type of allied health professional who is working with the public, patients, clients, who come to you with that general complaint of fatigue, you know what I'm talking about with respects to this concept of adrenal fatigue. There are literally thousands of people who are suffering with what some would call sort of the 21st century syndrome of adrenal exhaustion. Not everybody has it to the same degree. Some people are more severe than others. But when we think about stress, a lot of us are under stress, whether it's from family situations, financial, school, work, health, certainly, or just a myriad of these different factors. I know many years ago when I first became involved in integrative medicine, this was one of the first things that I learned about in how chronic stress can impact the body, not only from a hormonal standpoint, but how it can affect it biochemically, leading to things like chronic illness and diabetes and heart disease, autoimmune disorders, and then also the immune system problems that come about, which is so common with chronic fatigue, immune deficiency, for example. Many of the autistic children that I work with also have adrenal problems as well. So there really isn't a patient population that isn't touched by this particular problem. Now, conventional medicine generally recognizes only adrenal insufficiency, which is essentially adrenal failure or Addison's disease. But we know as integrative health practitioners, there are many, many, many more people out there who are dealing with a compromised adrenal function that's just impacting their health. So my partner and I, Dr. Trinkatella, have developed this course to be very specific for you as a busy practitioner, to learn the fundamentals of adrenal exhaustion, call it adrenal fatigue, but working with people with adrenal hormone cortisol output problems. Now, this course is a 9-module course that is very comprehensive in the information that it provides. We start off talking about the chronic stress response, or what also is called the chronic stress crisis, and how that manifests as many different types of comorbid conditions, many of which I just listed. We then go into lab interpretation and which labs are actually useful for adrenal assessment, including blood testing, saliva, and urine. And we also talk about why saliva is such a beneficial way of analyzing for cortisol output as well as DHEA, because it's the ratio between cortisol and DHEA that's very important to analyze to help you determine as a practitioner whether you're dealing with somebody who is in more of a catabolic breakdown state. We talk about protocols, we talk about staging. We also get into what I call reading in between the lines when you're looking at a cortisol, a salivary cortisol test. Because the numbers are one thing, but how do the numbers apply to that patient in the clinical setting? What's going on between the numbers? What are some things that may be revealed through your clinical intake about lifestyle, about chronic infections, about other types of stressors that could impact the numbers on the test? So it's always about applying the test results to the patient or client. We go through the biochemistry of adrenal support, the different supplements as well as the medications that are often used in these types of programs, or at least sometimes used. Certainly we want to understand how to use all of them, or at least as a practitioner for yourself to understand how they're used, even though perhaps you may not be able to prescribe them, and that's okay. We take it many steps deeper though. This is not a course that's just about a cookie cutter approach for adrenal assessment. You're certainly going to get protocols and have an outline of how to approach any particular given individual. But for many years, I know myself and my partner have felt that many people with adrenal problems often suffer with other biochemical imbalances. The mitochondrial dysfunctions, which are so common in chronic illness, has never really been discussed or linked up in any significant degree. So we go into how mitochondria also play a role in adrenal problems, and what are some of the different factors that can lead to adrenal issues, including many of the chronic infections that individuals carry, whether it's Clostridia bacteria or yeast or parasites. We talk about serotonin imbalances, which is also very common in people with adrenal fatigue, and how serotonin imbalances can be linked back to chronic infections. We talk and explain how adrenal assessment is critical if you're doing any kind of work with sex hormones, because imbalances in adrenal function will impact testosterone, progesterone, and estrogen. And how do all of these systems interact? One of the other things that we get into this course is this concept of methylation. Now, that isn't discussed a lot with regards to adrenal fatigue or adrenal exhaustion, but it can certainly play a role because the methylation system is also critical with regards to hormonal balance, immune function, and neurological function as well. And so many people who have adrenal issues, who are walking around with oxidative stress and inflammation, those too can impact methylation. I also do a bonus lecture in this particular course on the implementation of the organic acids test. This is a critical test to know how to learn how to use in your practice for a deeper assessment. And the two tests actually, when you're looking at adrenal profile, saliva, cortisol, DHEA, correlate very, very strongly with the markers that come off of an organic acids test. Being able to identify bacterial or yeast problems, mitochondrial imbalances, neurochemical imbalances as well. So that is a very important part I know that I have worked with for many years, and that is an added bonus for this course. So if this particular information is of interest to you, if you're looking for ways to improve clinical outcomes in your practice, I encourage you to look through the rest of this website on this page and join us in this very intensive, very informative, and really entertaining subject matter for adrenal mastery. Again, this is Dr. Kurt Wohler. Thank you very much.